I'm Cheryl. I'm one of the occupational therapists and outpatient at Ohio State. And Alicia, if you want to introduce yourself.
My name's Alicia Kempton. I'm a physical therapist, and I'm our brain injury and concussion team lead for outpatient rehab at Ohio State.
Awesome.
So we're going to talk to you guys tonight about headaches after brain injury and hopefully give you guys some strategies that you guys can employ yourself. So Cheryl's going to get us started from here.
All right. So hopefully by the end of all this, you guys will understand prevalence of headaches and brain injury, where to find resources and education for headaches and brain injury, and some lifestyle modifications for managing your headaches. We pulled some of the slides from Dr. Weber's presentation from last week, just because this is kind of a continuation from what he said. So if you weren't here last week, acute post-traumatic headache is one of the most common symptoms after head injury. 94% of athletes with sports-related concussions have headaches. There's several different types of populations that can get brain injuries. There's military, athletes, accident victims, assault victims, and workplace injuries. Headache is one of the most common symptoms after traumatic brain injury. It's often called post-traumatic headache. Over 30% of people with moderate to severe traumatic brain injuries report having headaches, which continue long after their injury. An even larger percentage of people that have had a mild traumatic brain injury complain of headache, about 37 to 69% of those people. And there's definitely different types of headaches you can get. So there's post-surgical, migraines, tension type, cervicogenic, which would be coming from your neck, rebound headaches, often from different types of medications that may be over the counter, and then medication overuse. This is a handout from Traumatic Brain Injury Model Systems. This is a very trusted website of Alicia's and mine. This is a small little group, about 16 rehab facilities that all get together yearly to make sure we're up to date, and we kind of just discuss who's doing what and what's working, what isn't. So this is a very small group that is amazing. So anything on their website is going to be a reliable source. We've got a QR code for you here. So if you haven't used one of these before, you'll just use your smartphone and hold up the camera over the QR code. A link will pop up and you just tap the link. This handout in particular is just a very general handout. Why are headaches a problem after brain injury? Why do I have headaches after I've had a brain injury? And what are some typical kinds? And then we have it in Spanish for you too. And they have several of their handouts in Spanish. All right, so we have headaches. What kind of changes can we make? What can we do to make these better? The first step you're going to want to do is get with a neurologist. This way you can discuss medications or even alternative options if you're not a big medication person. And then when you go see the neurologist, the first thing they're going to have you do is track your migraines. So you can go ahead and start this right away. It's a good way to identify triggers, to better understand how to cope and what to avoid. This will also help your healthcare provider tailor the treatment that they select and you select towards your needs. Managing triggers is going to be important. So diet, stress, light, noise, vision, posture, sleep, all important to kind of pay attention to as triggers. Also, you're going to want to conserve your energy, and the obvious one, exercise. There's different ways to track your headaches. You can do it by paper, and you can do it, a lot of people will do it using apps. This is a very basic paper chart that a lot of people will use. It doesn't give as much detail, but it's really easy to track trends. If you do it like this, you would just shade in the date that you had a headache. Then you can kind of see if it's happening at the same time of the month or the same time of the year. And this will help your doctor as well. Obviously, apps are kind of big right now. The number one headache and migraine app is called Migraine Buddy. The thing I like about apps is you can do it anywhere, anytime. Some of the apps will even allow you to provide information straight to your provider. And then it will help track trends. And this one in particular asks so many questions that I wouldn't have even thought of that could be related to migraine. It's very detailed, and then it starts to pick up on, what's really going on with you. So this is definitely a highly recommended app. Okay, so with diet, missed meals, caffeine withdrawal, food triggers, alcohol consumption, all can be triggers.
Sorry about that. There you go. Sorry.
It's okay. So caffeine is one of them. Maintaining a consistent amount of caffeine is what's important. So it's not that you can't have caffeine at all. You just need to make sure you're doing the same amount daily. Now, your neurologist, if you're having too much, they might ask you to cut back a little. You just want to do it gradually to avoid withdrawal. Hydration is important. Obviously, drink water, lots of water. We want 60 ounces of water per day. You can use an app if you have trouble keeping up with this. One of them is called Waterminder. A lot of people use these new bottles right there. There's a picture of them on the side of the screen to encourage you or kind of keep track. On the bottles, they actually have times. So at 9 o'clock, you want to make sure you drink to the 9 o'clock level. And this just kind of helps you stay accountable for your water. Obviously, alcohol isn't the best thing after you've had a brain injury, but if you are going to drink alcohol, pay attention to the different types that may cause headaches, what to avoid. And obviously, if you have too much, that can cause a headache. So trying to avoid alcohol is a good step. And then food, there's different types of food that can trigger attacks. So reducing or eliminating them from your diet can be beneficial. A neurologist can help suggest foods to investigate that are common triggers. Some of them are chocolate, onions, gluten, or MSG. Conserving your energy is something that I have to talk to my patients about a lot. I want you to keep in mind when you're having a bad day, is it absolutely necessary that I do this today? If possible, you want to minimize stressful or rigorous activities on days when you're having headaches. Save those complex or difficult tasks for days when you're feeling better. You can even, if you need to reschedule a social activity, that's fine. I often tell my patients, try to alternate tasks that take a lot of energy and then tasks that don't take as much. And you can alternate them or stagger them in your day to help get through your day a little better. And then rest if you need to. Listen to your body. Rest breaks are important. That's how your brain heals. I will say, if you are going to rest, I prefer the couch, the chair, the recliner, not so much the bed, because if you're resting a lot in your bed, your wake cycles can get off track a little sometimes. At night, when your head hits that pillow, we really want your body to know that it's bedtime. So if you do need a rest, maybe not do it in bed. All right, and then vision. Vision is something I look at a lot as an occupational therapist with headaches. Something that people don't actually always correlate to giving you headaches, but if you're having blurry vision or double vision, definitely talk to your neurologist about it. They might want you to go see your primary eye care doctor or even get a referral to see an occupational therapist like myself for further evaluation. And even, I know you're supposed to get your yearly eye appointment. I've had patients that maybe saw their eye doctor in March, then they had their brain injury in August, and they're like, I just saw him a few months ago. But I really highly recommend anytime you've anyone that's had a brain injury, even though you may have just seen your eye doctor, it's really common to have vision changes after this. So go ahead and schedule that appointment with your eye doctor. Make sure everything's still the same if you have had a brain injury. Sensitivity to light is also pretty common, and that blue light spectrum stuff is is out there now, and people are paying attention to it more now. Some of the things I recommend for that, there's filtering screen protectors for your phones or your computers. It's just a film you can buy and put right over them. The thing I recommend the most is this blue light filtering software for your computers. You just go to f.lux and it downloads straight to your computer. It's completely free. You can change to more amber light. You can change the times. So maybe you have more blue light in the mornings, but then it goes to amber in the evenings. If you're someone that gets headaches often, I recommend having the blue light mostly off all the time. This will help with your endurance and make you last a lot longer if you're someone that has to be on the computer a lot during the day. For all those iPhone users or smartphone users, make sure you're using your night shift. So you can find this in settings and then display and brightness. Again, you can change the time that the night shift turns on. I usually recommend having it on all the time, but some people just like it on in the evenings to try and get their eyes ready for bed. Blue light blocking glasses are becoming a lot more popular. There's a ton of different types, things that are way more stylish than these ones in the picture, but I would just recommend shopping online, looking at the reviews and seeing what's really helped people with that. And then you can even go as far as changing your light bulbs to blue light or amber light if you really needed it.
Cheryl, can I jump in real quick?
Yeah.
So just 2 points. So one, there is a great Android app for managing blue light, which is Night Owl. I use that every day. It's really fantastic. Again, free. So
that's great to know because I don't have an Android, so I'll write that down.
Yeah, Night Owl. And then Grace asked a question here. Is there a difference between a concussion specialist and a neurologist? I think this is a fantastic question. She saw a concussion specialist for months and they weren't helpful. And then there's a follow-up. So let's talk about the concussion specialist versus neurologist.
Yeah, so you can be a neurologist that specializes in concussion, and you can also be a doctor that's not a neurologist, but that sees a lot of concussion. We even work with our nurse practitioners that see a lot of concussion. So I would say there is a difference. I wouldn't say there's one that's necessarily better than the other if they're both people that specialize in concussion. Would you agree, Alicia?
Yeah. And I think the addition that I would add is there are neurologists, though, like if this is pertaining to headaches, that specialize in headaches. Dr. Weber, for example, he presented last week. He is one of our headache specialists. He just happened to also specialize in concussion, but not all concussion specialists specialize in concussion, and not all concussion specialists specialize in headaches. So you really just have to know your healthcare system and get into the right hands. So if something's not working for you, I always recommend get a second opinion. So if you're not feeling better, don't be afraid to reach out and get a second opinion.
And going along with that, so then Grace also asked, the tracking the headaches, but memory issues can make that challenging. I think, again, good point. How do you, we often talk about the things that you have to do at home to sort of be, your own self-advocate, collect your data, try and watch yourself or watch what's going on, how you're feeling. And then maybe your symptoms or, the effects of the injury can get in the way. How do you manage that? I mean, is there strategies for that? Is it just tough? Do you go to these apps? Like what kinds of sets of solutions are there?
So I know that when I'm having a migraine, the last thing I want to do is be on my phone and put in all this information on my app. So when I was really struggling with migraines, what I would do is set a timer that goes off once daily towards the evening. I just turned it off if I was fine that day, but it would remind me, oh, I did have that headache earlier. So reminders are going to be, I think, key. So if you're in a situation where you're having them regularly, go ahead and set a reminder. That way, when you're feeling better or when the alarm goes off in the evening, okay, yeah, I do need to track that. But if you let them build up too much, you're just going to start forgetting or get lazy and not put them in. So you really need to be pretty diligent about it daily. And this isn't necessarily something you have to track for the rest of your life. Once you figure out what your triggers are, it's not as big of a deal. But initially, you really want to try and set those reminders and be diligent with it.
And I would say just use whatever memory strategies maybe you have been working. Some people like the reminders on the phone. I think that's one of our go-to ones, like Cheryl mentioned. Some people have planners and to-do lists that they check every day. So just put that as an item on your to-do list in your planner, like report on headaches. Whatever's working for you, just try to find little reminders, like Cheryl said, to integrate it into your day.
Great. Okay. Thank you so much.
Absolutely.
Good timing, because it's Alicia's turn.
Yeah, now it's my turn. Good transition. That was a good break point. So Cheryl kind of talked about this a little bit earlier. Sleep can both help and provoke headaches. Oftentimes it's a lack of sleep that will provoke or increase headaches, or getting too much headaches can also be too bad. It's a fine balance, but they can also help your body rest and get into a nice sleep-wake cycle and relieve headaches. A lot of sleep disorders are often associated with headaches, and those with sleep disorders have more frequent headaches. So I've listed a lot of those here. If you have a morning headache, a lot of the associated disorders are snorers. If somebody has apnea, sleep apnea, circadian rhythm disorders, which is when sometimes you get confused on when your body should be awake or when it should be asleep, parasomnia, and nightmares. Chronic headaches have very similar things: migraines, cluster headaches, and tension. You can see all of those there, tension headaches. Now, how that relates to brain injury is sleep disorders are pretty high in brain injury as well. So 30 to 84% of patients with brain injury report sleep disorders. So you can see how that would translate into headaches. And 60% experience long-term difficulties with sleep. The most frequent sleep disorders that individuals with brain injury have for mild TBI, it's insomnia and circadian rhythm disorders. And moderate and severe TBI have hypersomnolence. There's also high percentages of the insufficient sleep maintenance and efficiency, delays or trouble falling asleep, waking too early, and again, nightmares can be very disruptive. In chronic TBI, 46% were found to have obstructive sleep apnea, post-traumatic hypersomnia, narcolepsy, and periodic limb movements or restless leg syndrome can actually affect the quality of sleep if you're not getting into that deep sleep cycle. So survivors with multiple TBIs are also especially susceptible. So they're at a higher risk for some of these complications. Again, we put in here a resource for you. So this takes you back to the TBI Model Systems website. They have a whole handout. You can use the QR code here that we got a lot of that information from. It talks about common sleep disorders and explains them a little bit more in depth if you have questions about that. And again, they also have a version so you can see it in Spanish if that is your language of choice and preference. And then I also wanted to do a little plug. Back in April of 2021, we had a whole NeuroNights presentation that is on sleep and prevention. So you can go back to the go.osu NeuroNights and go to the library. They were going to go way more in depth than what the tips and tricks that we're going to talk to you about here tonight. So don't forget to go back if you have other questions to help supplement this presentation. So some of the things that you can do to help improve your sleep is go to sleep and wake up at the same time every day. Try your best to do this. We know setting a routine for survivors of brain injury can be very helpful in regulating a lot of different things. Like Cheryl was saying, use your bed really only for sleep and sexual activity. If you're napping a lot in there, resting in there, but not falling asleep, doing work in there, your body just kind of associates it with a lot of daytime activities, and it doesn't resonate that it's time to go to bed, and it doesn't help your brain and mind shut off. You can develop a relaxing bedtime routine. This can be like mindfulness. Some people like meditation, breathing routines, or again, just whatever your bedtime routine is. But then once you get in bed, shut the lights off, calm yourself, go from there. Exercise. recommend avoiding moderate to vigorous exercise right before bed, about 2 to 3 hours. And they actually recommend doing exercise in the morning or early afternoon as guided by your healthcare professional. There's lots of different reasons why we might have specific recommendations for exercise with brain injury, and we'll get into that in subsequent slides. Avoid large meals or spicy foods 2 to 3 hours before bed. Avoid caffeinated foods and drinks 4 hours before bed. Try to avoid alcohol or smoking 3 to 4 hours before bed. Avoid daytime napping, or if you really need to nap, try to limit it to just 30 minutes so it's more restorative versus falling into that deep level of sleep. And this kind of goes into your bedtime routine, but try to make your sleep environment comfortable and relaxing. And if you're still having issues, talk to your doctor or healthcare professionals regarding these issues that you're having or any underlying sleep conditions, and your team can help you figure out where exactly you can improve your sleep health. And kind of leading into the next topic of ergonomics, some things that we recommend for sleeping, back sleeping and side sleeping are actually some of the top recommendations to help reduce headaches and improve your overall efficiency for sleep. Sleeping on your back is number one recommended. It's best for your spine and neck. Cheryl and I have kind of talked about this a little bit, but your neck can be a lead cause of your headaches. So if you're laying on your back, there's usually no tension or strain and torsion on your neck. And the goal is to always have a neutral spine. So on your back, that's typically about one pillow. A lot of people like to sleep on their side. This does require an increased pillow height due to the width of your shoulder. So I always tell my patients, imagine if this is the bed that you're laying on and you have to fill this whole space. Depending on your pillow width, if you have one pillow, you're going to be sleeping like this all night. If you have 3 to 4 pillows, you're probably sleeping like this all night. And that's just really stressful to your neck. So 1 to 2 pillows, depending on the width. And they even reported that sleeping and side sleeping, 75% of patients with sleep apnea had improved sleep quality. So that would fix the sleep apnea, which would fix the sleep, which would fix the headaches. But that's obviously, sleep apnea is a very personalized program. So talk about that with your healthcare professional. And then stomach sleeping, we really don't recommend at all. I am a bad teacher here because that is my preferred sleeping method. So I know that that can be really hard. But when you sleep on your belly, all you're doing is really, you have to rotate your neck, to put your head on the pillow. Otherwise you can't breathe. So this just increases your torsion on your ligaments, your disc, the joints in your neck, and really increases your muscle strain. So you're already going to be fighting an uphill battle when you first wake up in the morning. Some other ergonomic, and all ergonomics really means is kind of like your body positioning and your posture. And from that standpoint, you really addressing your ergonomics can help to reduce migraines, cervicogenic and or tension headaches, like we've been talking about. One study tried to compare strength training to just ergonomics and postural corrections. And strength training reduced headache frequency by 11% and the duration by 10%, but just having proper seated mechanics and ergonomic posturing reduced headache frequencies by 24% and duration by 27%. So without exercise, just improving how you're aligned potentially could help your headaches. I know we all do this a lot in the office. We all have our beautiful little setups because we look at the computers all day with our jobs. And on the next slide, I'll show you a couple things that you can do to improve that. And I already talked about this, but improper pillow support really can lead to an increase in your headaches as well. So this is a little bit busy, but the biggest takeaways that I want you to get from this is really in terms of computer work, you should try to have that at eye level. You want your keyboard to be positioned so that you have a nice 90 degrees and your elbows and your shoulders are relaxed. We're not up here typing or we're not down too low. And then they recommend having your hips and your knees at 90 degrees. So you might need a little footstool to help do that. Laptops really are not super great for us because we're often looking down and straining our neck, which can increase headaches. So a couple things that you can get, we recommend these a lot to patients. They're relatively affordable. There's some really fancy options you can go for if you want to go big. But the one on the left, you can get all of these off of Amazon. But the one on the left is pretty simple and compact. It can fold down. And then the one on the right can definitely adjust a little bit more in height. Typically, if you get one of these, people will get like a wireless keyboard as well, so that you can have that down here and now you're not typing up here on your computers. So just keep that in mind. And then the other thing that we talk about a lot is our cell phones. You know, cell phone gets a bad rep because of the blue light and the screen, but also think about how we're using our cell phones. If you look at the picture, we're often like this, you know, or looking down at our phone, and that can be very strenuous to your neck and your mechanics. So you can try to hold your phone up just slightly below your eyes. There's certain holders for your phone if you really want to get those, if you're, for whatever reason, you're using your phone a lot. If you're talking on the phone, they recommend using a headset so you're not doing this as well all the time, because again, that's bad positioning of your neck. And then the most simple thing, just take a break every 15 to 20 minutes to, you know, stop from looking down, maybe do some stretches if you need to, and adjust your body from the worst thing you can do is hold a position for too long. That prolonged strain can increase your headaches and tension.
Alicia,
and then, yeah, go ahead.
just real quick, someone had asked if we could just kind of slow it down a little bit.
Yes, I can slow down. Sorry, we wanted to get through it, but I'll absolutely slow it down.
Thank you.
So in regards to exercise, similar to sleep, exercise in regards to brain injury and headaches can reduce, but also cause headaches if you're not careful. Some people are triggered by exercise. And if that's the case, that you're exercising and you're getting headaches, again, talk to your neurologist or your physical therapist or your doctor and see if you can get into somebody that can help you with that. Typically, what we'll recommend is what we call a graded or sub-threshold exercise program. So that basically means that we're going to exercise below a threshold that causes your headaches. And we'll work with you to personalize this and get back to what you need. Aerobic exercise, which is more of like your cardio exercise that you would think of, is found to have a positive effect on migraines and reducing the frequency. This often helps with reducing hormones and stress levels and can be a good out for patients. In regard to resistive exercises, so strength training with bands, weights, machines, this has a positive effects with tension headaches. So again, depending on your tracking and what type of headaches you have, this can guide what exercises we might recommend for you. Other ways that exercise can reduce headaches is, as we talked about before, exercise can improve sleep, reduce stress, and overall reduce triggers for headaches. And just a reminder, it's recommended to perform in the morning or the early afternoon. And this can be cardio strength, but also stretching programs. Don't forget the value of stretching. This is seen a lot in yoga, which is what's on the next slide. In one of the most prominent brain injury specific yoga programs that are out there is a program called Love Your Brain. The founder of this program actually spoke at the Brain Injury Association Summit last year and was fantastic. So if you haven't heard that whole story, go to their website and just learn a little bit more about their program. They're great. Yoga has been found.
And they're coming back this year.
Oh, beautiful. Perfect.
Yep.
That's awesome. So that's a little plug for you guys then, another incentive to go to the summit. In regards to yoga, it can help reduce headache frequency, duration, and intensity. It can help reduce medication intake. It can help reduce somatic symptoms accompanied with headaches. So those are like the physical symptoms and a lot of tension and other things that you'll feel. And then it's known to reduce stress perception, anxiety, and depression. So this is a little bit more about their program. So we used to have a program in Ohio, but I know maybe not everyone in this, in Ohio that was in person. That did get kind of shut down with COVID and having yoga classes there. But with COVID, Love Your Brain has done a fantastic job of creating online resources specific for yoga, group discussion, and or mindfulness, really whatever your needs are and your desires. So you can go to their website, you can check it out, and enroll in whatever program fits your needs and your lifestyle. And they even have some free stuff in there already available if you just kind of want to take a short little mindfulness video. And then lastly, we just wanted to talk about just kind of, headaches are a form of pain. And so, we've talked about a little, some different strategies, but overall in regards to pain management, we're going to encourage that multidisciplinary evaluation to assess the origin of your headaches. We've just touched on this a little bit throughout our presentation, but like we said, they can be triggered by a lot of different things. It takes a lot of tracking and skilled evaluation to really hone in on what is your specific trigger and origin of symptoms. You should follow up with your physician or headache specialist. We kind of differentiated that a little bit earlier. And then a couple unique programs that OSU has that might be appropriate for you is a program that's called OSU Pain School. And I'll talk about that on the next slide and show you how to reach out to the coordinator of that. Or you might be appropriate to our OSU chronic pain program. Cheryl and one of our other PTs have used this a couple times with some patients. And it's just an all-encompassing evaluation by physical therapy, occupational therapy, rehab psych, and pain physicians that might just give a fresh new perspective. You do need a referral to that program that you can get from your doctor or neurologist. I don't know if you want to speak on that at all, Cheryl, about from your experience with patients, or I can just go to the pain school. But
my understanding is it's like it's online and it's a few week course where they'll go through different kind of like chapters, of how to deal with pain and things like that. And they have pull in different specialists and stuff.
Yeah. So I think if you get referred to the pain program, I think what they recommend automatically is the pain school. So for the pain school, it's a 4-week program that's offered monthly. So you can see this kind of lays out the schedule. They do a lot of what we just did here, I think just a little bit more in depth over a longer period of time, talking about spine health, posture, ergonomics, mechanics, activity management, energy conservation, pain meds, different types of meds, mindfulness, eating practices, pain, sleep, and a couple other things. So if you're interested or questioning if this could be a program that's good for you, you can see at the bottom of both of those flyers there, Lauren T. Meyer, and that's the phone number that you can reach her at. So if you're interested in that at all, you can reach out to her and see if that could be appropriate for you as just an alternative strategy. And then lastly is just to other resources that could be available to help with your headaches. Massage therapy is known to help with migraines, cervicogenic tension headaches. Osteopathic manipulation. It's a lot of people think this is similar to going to a chiropractor. It's similar, but just a little bit of a different mindset and treatment style. You can get acupuncture or dry needling. And then again, really integrating mindfulness and meditation to help undo the body's stress response, reduce your muscle tension, and just decrease your overall heart rate and blood pressure. For more information about some of those programs that are offered, especially at OSU, again, there was a great topic on this just recently in June of 2021, where the integrative medicine team talked about the benefits of all those types of interventions on headaches and for brain injury survivors altogether. And really that's it. That's all that we had for you. This is the contact information for both Cheryl and myself. So that's our email. If you guys have specific questions that span beyond this, or if you're watching this recording later, you can feel free to reach out to us and we'll see what we can answer for you. So I don't know if there's any other questions that came up in the chat or if there's anything else that anybody wants to chat about.
Thank you so much, Cheryl and Alicia. I did not see other questions come up in the chat just yet. You're all welcome to put questions in the chat, or you can, raise your hand and we can have you unmute and you can answer them out loud. Gosh, I don't have a lot of banked questions because you went through everything very cleanly.
Wow.
I know. Probably 2 years worth of presentations, and this is the first time I don't have a single question set up. So hats off to you. But yeah, if anybody has a question out there, I think probably if I want to make one up just to get us going. It just seems, again, like there's just so many different things. Like, Alicia, I particularly appreciate, that you plugged a lot of the different conversations that we've had in the past. But it's just one of those places where it seems like headaches are so intertwined with so many other parts of your injury symptoms, your, certainly your sensory systems. It's just a tough one. I mean, I guess, do we feel like we have made a lot of progress in this field over the last 10, 15 years? Or does it feel like it's kind of the same solution set? And maybe in some cases, our lifestyle is different, right? When you think about like smartphones and stuff, where we may be actually making things worse. I mean, how do you feel about that when you think about your patients over time?
I think that headaches are becoming more at the forefront. I think people are looking into them a lot more. I do feel like after someone's had a traumatic brain injury, there's so many things going on. So headache can kind of be overlooked initially, but if we don't get the headaches under control, there's so many other things that are going to cause problems. So I think they're just now starting to get on the forefront of this, especially with, concussion being a popular thing in sports and stuff right now. It's getting studied a lot more, but it's something that I never take for granted. It's one of the first things I think about and with my patients. And if you have headaches all the time and they're not being managed and I'm supposed to do therapy with you, we've got to get those headaches under control. So all this education you saw today, that's like my first few sessions. Like, we've got to nip this in the butt.
Yeah. And I think Cheryl summed that up pretty excellently. I think for clinicians, I always tell my patients, from concussion to severe TBI, I think headaches are one of the most challenging things that we treat. And if my patients come in, and they don't already have a referral for occupational therapy, I'm always looking for my partners in the clinic to really help me get that overall evaluation, because there's just a lot of factors that could cause it. And you kind of have to just try one thing. And if that doesn't seem like it's making it better, like if I fixed your neck range of motion, but you're still having headaches, it wasn't coming from your neck, but we made your neck better for other reasons. So it's a little bit of diagnosis of exclusion is what we like to call it. We just have to kind of cross things off the list and go from there. And then unfortunately, I think the world that we're living in is just very technology forward. So we use laptops a lot more. We're doing this event versus being in person. We use our cell phones all the time. So all those positioning things, those light things that Cheryl and I were talking about, they're just a part of our everyday life. You almost can't get by without them at times. So we have to find ways to adjust and accommodate to that, because that's our goal, is to not have people feel like they can't do things. It's to find ways to do them. And it just might mean modifying it in a different way. And then at times, I think that people just kind of write off headaches as well, right? I have a headache. How often have you been like, oh, I just have a headache today. I'm just going to take some Tylenol or something like that, or sleep it off and we'll come back to it. Hopefully it's gone by tomorrow. But when you start to see that pattern, it's always there. I never don't have a headache. It's starting to impact what you're doing from day to day. That's when it's a problem and it's not okay. So don't write off something like that. Don't accept it just because you had a head injury. We can take a look at it and we can see what we can try to do for you guys.